Hello viewers, hope you all are doing fine during this lockdown period. Today I want to discuss about an important topic related to this lockdown period, that is controlling the impulse of eating something between our meal times. So what I mean by that, suppose you have a meal at around 11:30 to 12 and the dinner at around say 7:30 to 8. Now the gap in between these two is quite big. If we are filling this gap with nutritious fruits, recommended beverages which are low on caffeine, most preferably, or nil on caffeine rather, then it's not going to harm us. But most often it doesn't happen so. Due to the uncontrollable impulse, people tend to have snacks like samosas or bhajis or vadas or papad or chips or nuts, masala nuts, whatever you call it. Most of these snacks have rice flour in combination with oil content or ghee, or besan flour, that is gram flour with oil or ghee, mostly refined oil. Now what these do to the body is something to be discussed subsequently, but we need to understand the first thing which is going to harm us: having these food items when we are not really hungry. Having these food items when the season is not conducive for having these food items. The season is summer, the digestion is not that great, but the impulse to eat it is not because of real hunger but because of the urge to eat it, and that's not going to do good to the system. Secondly, having food before the digestion of previous meal, which we call as ajirnashanam or adhyashanam, based on certain specific factors involved, that will increase the unmetabolized portion or partially metabolized portion or harmful metabolic products. People start telling that they have fatty liver, triglycerides, increase in the blood test, or increased cholesterol levels, low high density lipids, high VLDL, LDL, etc. Now these are not just because of the food, these are because of the food habits, the dietetics which we follow. We don't have food exactly when we are hungry, and the food doesn't convert into beneficial things inside our body because we didn't have it when we were really hungry. So on our part, it is very important to follow the guidelines. Secondly, by nature these food articles, as I said before, are increasing kapha pitta because they are snigdha, that is slightly oily in nature, and guru, heavy to digest. Some of them have hot potency, that is, if you add more masala or chilies or something like that, they have hot potency, and some of them have the tendency to create vadam, that is nuts or besan flour, they increase vadam. Now what does this vata do? This vata circulates in the stomach and creates a pseudo hunger, increasing the demand further, or it can cause bloating and pain in joints and sometimes even muscle pain. People may suffer from renal colic or kidney stone pain even if they have more of nuts during this season, because water demand or fluid demand is more, and nuts are actually exactly opposite in nature, that is, they are more of solid content. So what is the way out? The way out is very simple. In case you feel hungry between the meal times, better go for fruits or low glycemic index food articles like what we say parched rice or aval. So in Tamil we say aval, especially red rice, made from red rice. Soak it in water, let it become very soft. If you are not diabetic, add some little jaggery and little coconut if required, and then you can have it. Even then, better don't go for the aval upma, because there again you're going to add oil and you're going to cook with it in spices. So better stay out of spices and include more of water based food, and in case if you're hungry, go for aval kind of food, and better you take fruits which have more watery content. That will do more good to the body than the actual solid foods which you are planning to have. Hope this short video was useful to you, you can submit your queries on this Facebook page or on the YouTube comments section. You can contact us on WhatsApp through 8939933150. Signing off from this video is Dr. M. Harikrishnan, myself from Dr. Hari's Samhita Ayurveda Shala, Chennai. Thank you.